All right. So for those that don't know me, my name is Ariana Gutron. I am a trainer for San Isidro Health, focusing on the PACE program, which is the program where we offer our services for seniors. I've been working for San Isidro Health for the past almost 4 years. In just a couple of months, I will be 4 years working for San Isidro. I I started as a nurse assistant. I am a certified nurse assistant, and I worked for 3 years in the physical therapy department area, working with physical therapist, occupational therapist, as well as speech and language therapist. After that, I have moved on to provide trainings, and I am also a medical assistant. So, welcome everyone for being here. I think you are caregivers, you provide care for others, maybe CNAs. So, some of the information you maybe have known already, learned it before, and sometimes it's just to refresh the information. But I also hope that you get to learn something that will eventually help you when working with others, providing care for them. So today we're gonna cover pain management. I'm pretty sure that you're very familiar with maybe people that you work with constantly complaining of pain. Could be back pain, could it be hand pain, shoulder pain, knee pain, and a lot of times this pain is for years. It's a pain that doesn't go away, and at some point is it becomes chronic. So that means that they pretty much live with pain for the rest of their lives because of different conditions. One of the most common cases could have be arthritis. Arthritis, of course, produces pain in joints, and people with and the elderly population is very common. That are have been diagnosed with arthritis or osteoporosis. So how can we manage that pain? There are different ways that pain can be managed, and that's why we are here today. So, and the overview of what we're gonna be seeing today is we're gonna go over the pain definition and pain management definition as well. The prevalence of pain in geriatrics, common causes of pain, assessment and techniques, and also pharmacological and non-pharmacological treatments used for pain management, as well as, always learning about caregiver support and resources. And then at the end, if you have any questions, you're free to put it in the chat and I will answer to you. Excuse me. Mm, Okay. So again, in this presentation, we just gonna explore the different types of pain. What are the factors that contribute to the pain, and the different approaches and techniques used to manage and alleviate pain. Also, by understanding the complexities of pain and available treatment options, individuals can work closely with their healthcare providers to develop a comprehensive and personalized pain management plan that will address their needs, which are unique, as well as their concern. Pain management is a critical aspect of caring for older adults as they often face complex health challenges and also unique barriers to effective pain relief. So that's what we're gonna be covering today. Again, it's well as a complex and multifaceted experience that affects millions of people worldwide. It can stem from a variety of underlying conditions, but also from injuries or chronic issues, and can significantly impact an individual's quality of life. So, effective pain management is very important for healthcare as it helps individuals find relief and improve their functionality as well as enhances their overall well-being. So, what is pain? In a more specific definition, according to the International Association for the Study of Pain, pain is an unpleasant sensory and emotional experience that is associated with resembles actual or potential tissue damage. And clinically, pain is whatever a person says that they are experiencing when they say it occurs. It could be a headache, a sore throat, an arm ache, chest pain, hand pain, finger pain. It can be foot pain. It can be ankle pain, hip pain. There's different type of pains, and it affects everybody differently. The a headache or a wrist pain is not going to be the same for everybody, as we all have different tolerance to pain. There's acute pain, and it's different from chronic pain. So knowing when and what the causes are, it is important. Acute pain could be caused by injuries, an illness, or surgery. Let's say somebody fall and hit their shoulder. So that shoulder could be in pain. It appear after having the fall. It could be due to an illness. It could be that you get stomach infection and you're experiencing cramps, you're experiencing stomach ache that came out of nowhere, or surgery, having after surgery, if depending how invasive it was, following the surgery, you will have pain. And that's called acute pain versus chronic pain. The causes, it's always underlying conditions or improper healing. So underlying conditions that we're gonna cover, but I mentioned earlier, arthritis. So it is a chronic pain. It is a condition that it is going to be there as it doesn't have a cure. It can only be controlled. So that's an underlying condition, but also improper healing. Somebody that had a fracture and didn't got the proper treatment, it just let it happen. So, and pretty much heal on its own without medical treatment. So without that proper treatment, that bone could not have healed properly and got back to normal. So it could get um give you pain for the rest of your life, and that's because it was not properly treated. When it comes to acute pain, the timeline, it can be hours, days, or weeks. Those That's acute pain. You can have that pain for hours. You know, you can have, if it is like a headache, you can have it for 1, 2, 3 hours until you take a painkiller. It could be for days. You know, you had a sprain on your ankle, and you know, it that's acute. It came suddenly, and then it recovers. Or when you go to the gym, you know, and you're sore from the legs from exercising. It's the timeline is just a few days. Others are maybe weeks. You know, if you had a surgery, of course, it's gonna take a 3, 4 and even more than that to for that pain to actually go away. Compared to chronic pain, the timeline is it's considered chronic pain when you have had that pain for months, years, and it may never go away. That's considered chronic pain. Symptoms for acute pain, it's severe. It is sudden and onset. So it is a very painful situation that you might be having, and it just happens out of nowhere. You know, it can be caused, yes, because of an accident that you might have had, but it was not expected. It just happened right away. Compared to chronic pain, it dull aches or shooting pain that comes and goes. And this is for a long period of time. For as we saw on the timeline, could be months, years, and never go away. For acute pain, the treatment would be to visit a doctor, as the doctor will find out, if you have a condition, you are given pain medication, and that's gonna relieve and cure that pain. While chronic pain, it's a variety of treatments, and they professionals and doctors try to use non-invasive treatments. So we're gonna cover that part. So acute pain, sorry, serves as a warning signal and typically result within days or weeks. So if you're suddenly getting pain, it could be if you're it's in the stomach area, the abdominal area, it could be warning you. It's a signal that there might be something going on, you know, um, an infection, or depending where it's located. If you're a woman, could be coming from uh the womb, the uterus, and anybody in general could be kidneys problems like stones. So, those type of pains that come suddenly could be the indicator that there's something going on. Chronic pain is just persistent and long lasting, meaning it stays there for months and years. And it can be caused by the underlying conditions that somebody might have. Chronic pain impact a person's quality life. In some cases, acute pain can evolve into chronic pain. So some of acute pain caused by an injury can turn into a chronic pain. That can happen. That's particularly if the underlying cause is not adequately addressed, as it was mentioned before. But effective pain management is essential to prevent that transition. So, what is pain management? Now, we know what pain means, but pain management is the process of evaluating, diagnosing, and treating pain from injury, surgery, chronic conditions, or labor. And it can involve a multidisciplinary approach. That includes, doctors from different specialties, anesthesiology, neurology. Pain management can provide relief so people can enjoy their life better. Your guide to pain management, of course, is always consult your doctor when you're experiencing pain. Sometimes over-the-counter pain relievers work, Tylenol, Advil, and implemented mind body practices. Sometimes a moment of relaxation also helps the pain. If you're overthinking about the pain, of course, you're having pain, but you're stimulating your brain as well, and that's going to play an important role. In some cases, physical therapy will be something that helps, counseling, and always educate yourself and others about pain, management. Exercise is very important as well as a good nutrition. The prevalence of pain in the elderly population, well, we know that chronic pain is a common health issue in elderly, and it affects between 25% to 80% of the global population. The prevalence of pain varies depending on whether the older adults live in a nursing home or in the community, ranging from 25 to 75% in the community and up to 83% in long-term care facilities. So people that is living at their home, their pain chronic pain experience goes from 25 to 75% compared to people that is staying at nursing homes. For example, they experience more pain. Pain in the elderly is often under recognized and under treated. I think my okay. One thing that we need to understand is that pain is not a natural part of aging, and it can contribute to functional decline, as well as mood disorders and an increased for fall risk. Unrelieved pain can also have a negative impact on quality of life, as well as social function, the activities, and the mood, as I said. Some common causes of pain in older adults include musculoskeletal conditions, neurologic conditions, and osteoarthritis. Pain is often, as I said, under-recognized and undertreated. So we are sometimes not paying attention to what an older person telling us that they're having some pain. But it is important to know because this overall contributes to them not functioning in their daily life, and they just start declining. If they're having some back pain, if they're having some knee pain and it's not being treated, that's just a risk for falls as well. Uh, as I said, musculoskeletal conditions like arthritis, osteoporosis, degenerative spine, joint and skeletal surgeries, as well as fractures. These are conditions that affect the bones and the muscles. So those are some of the common conditions that we find in seniors. We also have causes that are neurodegenerative conditions, such as nerve pain, which is pain associated, like the sciatica is one of those, but also diabetes. Diabetes affects the nerves and the sense. So that can lead to chronic pain. And shingles, when somebody has shingles, uh, they can have chronic pain for the rest of their lives as it affects, it's a virus that affects the nervous system. So, how diabetes affects the body or how is it associated with chronic pain? It's because of diabetic neuropathy. So, there is a diabetic peripheral neuropathy that affects the legs and feet. And those are the most commonly affected areas of the body. There's a diabetic autonomic neuropathy, and this affects the digestive system, especially the stomach, but also the urinary system, blood vessels, and reproductive organs. Diabetic proximal neuropathy causes pain in hips or thighs, and it may also result in weakness of legs, which is associated with fall risk. And pain is generally on one side of the body. Um, Diabetic focal neuropathy. This can appear out of the blue and it affects specific nerves, most often on the head, torso, leg, and results in muscle weakness and pain. Other causes for pain could be peripheral vascular diseases, that's ischemic pain, We also have the congestive heart failure and the renal disease that affects the kidneys. Also, pulmonary obstructions. Those are chronic or those are conditions that affect and can cause chronic pain. Other causes could be the bowel disease, old injuries, pressure injuries, the urinary tract infections, and fibromyalgia. How does do professional assess people having experiencing pain? Third off, a pain assessment is essential for developing, creating an effective pain management plan for older adults by identifying the root causes, evaluating the severity, and understanding the patient's unique experience. That's how healthcare providers can create interventions to address the multidimensional nature of pain. So it is important to assess pain. Number one is to identify the causes, determine the underlying medical conditions or injuries that are causing that pain. After that, you have to evaluate the severity, assess the intensity of the pain, the frequency, and the impact of pain on daily functioning. How is the pain affecting you doing your things that you normally do during the day? So it is important to evaluate how severe it is and understand the patient experience. It is important to consider the patient's subjective report of their pain and how it is affecting them. Again, pain is not felt the same for everybody. Broken arm could somebody could not experience pain while others are just experiencing a lot of pain because we all feel different. It is important to have a comprehensive evaluation, and when it comes to evaluating the severity of pain, they use validated pain rated scales such as the numeric rate scales or visual analog scales to quantify the patient's pain intensity. Multidimensional assessment and the evaluate by the physical, emotional, and functional impact of pain on patients and quality of life and the daily activities. And of course, ongoing monitoring. Regularly reassessing pain to track if there has been any progress, adjust treatments, plans, and ensure that effective pain management over time. Pain assessment techniques. It's the number one is self-reporting skills. This include numerical rating scales from 0 to 10, which are verbal descriptive skills, not pain to worse pain, and visual analog skills. You might be familiar with this when you go to the doctor, you might be asked from 1 to 10, how much is your pain? And you're rated based on what you're feeling. Numbers 1 means you're not having any pain, to number 10, which is a very acute pain. There's a pain questionnaires, and they're validated pain questionnaires such as the McGill pain questionnaire and the brief pain inventory, and this provide a comprehensive evaluation on the patient's pain experience. So these are questionnaires that are going to be provided by the nurses or the doctors when you attend the appointment because of the pain. And it's just to find, possible causes. What type of pain are you feeling? What were you doing? How does it feel? Does it feel sharp? Does it feel like burning? Does it feel like needles? How do you feel? So these are individual, because again, we all feel different. And of course, the physical examination is important. Physical examination by a healthcare provider, a doctor, is important when assessing for pain. And this may involve different techniques like palpitation, observation of movement, and testing of reflexes and sensory function. And the goal is, of course, to identify where is the pain coming from and what could be any underlying conditions and the impact of patients with their physical functioning. So on the self-reporting scales, patients are asked to rate their pain intensity, allowing healthcare providers to track changes over time. So they say that what you said at the beginning of on your first appointment, they keep that information whenever you come in again. They would ask you again to see if there has been any improvement. And to also to see if there need to be an adjustment on the treatment and it is a widely used method for assessing pain, meaning it's very common for clinics to use this technique. The questionnaire is assessed not only for pain intensity, but also the location. Where is it located? Where do you feel it? The quality of it, and what's the impact on your activities and quality of life. And this helps the doctors gain a deeper understanding of the pain's profile that the patient is having. When it comes to treating pain and management of pain, there is, of course, drugs that are used. And the most common classes are the opioids, like oxycodone, hydrocodone, tramadol, and morphine. You may be familiar with some of those names. And these are opioids. And the mechanism, or what is the action that they have, is that they are highly effective for severe pain, but the side effects is that they carry a risk for dependence and respiratory depression. So people that is on use and under the use of this medications that are opioids, they have the risk to develop that dependency that eventually becomes like an addiction to them. So that's why, doctors are very careful when they're prescribed these medications because they have that side effect. We have the NSAIDs like ibuprofen, naproxen, diclofenac, and aspirin. Aspirin is also used for pain. Uh, and you're more familiar with these ones. And how this work is that they reduce the inflammation and pain, but on the other side, they can have a gastrointestinal and cardiovascular side effects. So they can affect your um, stomach, but also your heart. Um, the antidepressants are also used for pain management. Medications like duloxetine and tricyclics, sorry, they reduce the neuropathic pain, and they treat comorbid depression. That's what they're called, antidepressants, and improve quality of life. They have the ability to give you that motivation and energy. So it improves, again, the state of mind has a lot to do with pain. So somebody that is experiencing pain and it starts getting depressed, that affects the pain and it will just feel higher. So using antidepressants in some cases just improves their quality of life, but they may also have mood elevating effects. So they change the mood of a person from being depressed to be happy. That's one of the good ones, of course. Anticonvulsants like gabapentin and pregabalin. This effective for neuropathic pain and improve the sleep due to sedation effects. And it has a low abuse potential, which is the good thing. But on the other side, this can cause dizziness. So somebody can, like, especially the elderly population, they're more at risk for having a fall as it makes them dizzy. The topical agents, of course, are medications that are topical, that are applied to the skin in the area that you're having the pain, like lidocaine and capsaicin. And this provide a localized pain relief, and it minimizes systematic side effects. But they may cause, because you apply it to the skin, they may cause skin irritation, but also reduce potency. So they cannot be strong enough sometimes for the pain that you're having. On the other side, we have the non-pharmacological approaches to pain management. One of the non-pharmacological things that are used is exercise. And they have a low impact exercise like walking, swimming, or yoga that help improve mobility and flexibility as well as the strength. And this helps reducing pain and better quality of life for adults. So exercising is very important when it comes to managing the pain. The physical and occupational therapy, these are specialized, programs that address pain through different techniques like massages, heat and cold therapy, but also personalized stretching and strengthening exercises. Other non-pharmacological approaches are the cognitive behavioral therapy. The cognitive behavioral therapy helps patients develop coping strategies to manage pain, understanding, if they have arthritis, they understand how arthritis works. We always mention patients that arthritis is not gonna cure. It can just get worse. The only way that you can treat it is, through exercises. And some medications sometimes work, sometimes they don't work. But also having the cognitive behavioral therapy reduces their stress as they have somebody that they can talk to and relieve that stress that they're having and improve their overall well-being and functionality. Acupuncture is another one that is used for pain management. And acupuncture is a Chinese practice that has been used for millions of years. And this practice provides pain relief by stimulating a specific points on the body to promote body's natural pain relieving mechanisms. So acupuncture helps a lot of times for managing pain. Uh, education and support. Caring for older adults with chronic pain requires a specialized knowledge and skills. Caregivers need, of course, the education on pain assessment, medication management, as well as the non-pharmacological interventions. And support groups and counseling can help caregivers to cope with the physical and emotional demands of caregiving. Of course, it's not easy when you are taking care of somebody that is in constant pain because of what the reasons that we mentioned. It changes the person's functionality. Maybe they might require a lot more help, but also their mood changes. So if they're in pain, we all have gone through that. Whenever you have some type of pain, you get angry sometimes. You don't want anybody talking to you. So just the same things they go through. So that not only affects them but also affects you as caregivers. So group support and counseling is very important, as well as regular check-ins and respite care are crucial to prevent the caregiver burnout, and also providing caregivers, excuse me, mm, providing caregivers Goodness, going on. So providing caregivers with the right tools and information empowers the caregivers effectively to deliver effective and more compassionate care and improve the outcomes of those that you're taking care of. Ongoing support and collaboration between the healthcare providers and health and caregivers, as well as the peak collaboration from patients, is important when managing pain in older adults. Some available resources that are out there. Of course, the more that you know, the better that you know how to react in specific situations. Online trainings and webinars that are provided by, different associations or schools, in this case, through CalGrows. We provide this kind of trainings where we want to provide you guys with enough information that can help making your uh, work easier. And you can always, there's a link that you can always go to if you need to know any other topics. Community programs that offer multidisciplinary care is very important as well, and get involved in the ones that you take care of. San Diego Face is one of those multidisciplinary programs that we have, of course, because we have their doctors, we have their physical therapists, we have their nurses, and we work closely with other entities like big hospitals like Sharp, where where we all just a big network, and this can help helping the and providing the care for those that are experiencing pain, and not only pain but other issues.